snoring, breathing that stops and starts at night, tired during the day, they are very classic symptoms of sleep apnea.
That's right. And for the last few decades, people have used a CPAP machine to help, but now more people are turning to specialized dentists. Dr. Nicole Chenet is here. Dr. Chenet, we know sleep apnea is a medical issue that can cause serious problems, but how are dentists helping with this?
Well, we've been doing this for the past 30 years. This has been a medical device for the past 30 years, but it's really gained traction over the past 15 years within the medical community. What we do is we provide an oral appliance.
And that's what you're holding right now in your hands.
And this is what it looks like. And what it does is gently just brings the jaw forward in a certain position that we determine best for the patient.
Would you mind if I see this?
Go for it, yeah.
So these almost look like
Invisalign.
Invisalign or something, like even just a retainer.
Yeah.
That's right. But what you could see is that on the sides,
These little pieces.
Yeah, those little wings help to bring the jaw forward. And what it does is when you bring the jaw forward, you're bringing your tongue forward and taking it away from the soft palate so the patient can breathe better.
I was going to say, I think for people, a lot of the hesitation to get a device that could help with sleep apnea is because there's this preconceived notion that it's going to be this huge apparatus, and when they go to sleep, they might scare their partner when they wake up.
That's right. I feel that so many people don't even get tested for sleep apnea, which you absolutely should do. The impacts of sleep apnea on every other aspect of your health are pretty tremendous. We're fortunate here in Pittsburgh that we work in such a strong, I feel the strongest sleep medicine community in the country. And so we coordinate care with our sleep physicians to get the patients treated.
So I talked to you a little bit about this. So you really want to go see your doctor first, and you want to find out like a sleep score of sorts to find out where you land on this, right? What is that exactly?
So what a sleep physician will do is determine if you need a sleep test. Typically, most people do a home sleep study first. We must have that test. So in order for them to then refer the patient to me to be treated. So once the person gets diagnosed, and if they have sleep apnea, the physician will then refer the patient to us for an oral appliance. Another thing to mention is that a lot of people think CPAP is the only option.
And I think that's probably one of the biggest misconceptions that people think is that I'm gonna have to sleep with this big bulky thing.
That's right. So really anybody who's seeking relief for their sleep, going to any physician, especially here in the greater Western Pennsylvania region, should have the conversation, and it should be given as a choice to, do you want to try CPAP or do you want to try oral appliance? Yeah. The other thing that's really important to mention is that this falls under medical insurance and not dental insurance. So my practice is one of the only practices in the Western Pennsylvania region that because of my certifications, my board certification is in medical insurance plans for it.
I think this is so fascinating too, because you were a general dentist at some point, and then did you kind of like fall in love with helping people with this, or why did you make that move to focus simply on this?
It came, usually there's a personal reason, and usually I listen to my patients. And so many of my patients were saying, hey, I can't do CPAP, I'm miserable, I'm exhausted, can you make me that thing that goes in my mouth? That was 15 years ago, and I decided I'm gonna take the journey then to do another additional step in education and become board certified in this part of our field.
Yeah, I know you were talking about additional medical conditions that can affect sleep, but what if you're already suffering from TMJ? I know a lot of people who have jaw pain. Would this be an option for them too?
They are the primary candidate for this. So 35% of our patients with obstructive sleep apnea, one of their primary symptoms is jaw pain. Why do we have jaw pain when we're sleeping at night? Think about it. Your body goes into a natural defense mode, and as a means to open your airway, we thrust, we clench, we grind, as a means to say, wake up, breathe, breathe. So when we are treating the overall patient with an oral appliance, what I'm doing is giving them relief of those symptoms. So many people think, oh, I can't wear that, I have TMJ. Well, probably with majority of those patients, the reason they have TMJ and wake up with pain throughout the night or into the morning is because of obstructive sleep apnea or obstructive sleep apnea that they haven't diagnosed yet.
So fascinating, really good. And I think it's to know that this has been going on for almost probably as long as the CPAP, and that it's an option is huge. It's great to know this is in our backyard.
Yes, and I mean, I can't tell you how often every single day patients say, Why wasn't I told about this
Yeah.
Right.
4 or 5 years ago?
Well, because, and especially for a lot of women, you know, not that we're going to look like Sleeping Beauty when we're asleep, but this is a much nicer,
It is.
easily, gentler way to go to
Absolutely.
sleep. But yeah,
Yes.
I
Thank you so
actually
much.
even brought my own. You
That's
know,
great.
You know,
Great.
so I mean, it's easy, it's simple, and we love providing it, and we love giving patients their sleep back.
Well, thank you so much.
Thank you for
Wonderful
coming.
information.
Yeah.
If you're interested in learning more about the devices or to schedule in an appointment, we will have the link on our website, kdka.com/talkpittsburgh.